Welcome to Module 3 about symptom management, Part 1 on pain. Pain is by far the most prevalent symptom in palliative care and hospice patients. It's very important to assess and manage pain and to balance your pain management against side effects. Many factors influence pain, and there are ethical issues associated with pain management as well. Not all pain management approaches are pharmacological, although most of the ones that we will cover are. Another issue to think about when considering pain management is that if pain remains unmanaged or poorly managed, the pain can cause a downward spiral, a cycle of interaction with depression, anxiety, and sleep problems. Treatment of pain involves assessing and managing the pain and balancing your treatment plan with side effects. Pain, as we've all learned, is what the patient says it is. It can also be observational. If you, as a provider or a nurse or a physical therapist, speech therapist, occupational therapist, pastor, whatever, if you observe that the patient is in pain, it's worth having a discussion with them. And it's also important to note when you're assessing a patient's pain to get them to describe the type of pain it is. Is it burning? Is it there all the time, like a toothache? That kind of thing. And you'll see when you do your readings that there are several pain assessment tools available. In fact, there are many types of pain tools available, pain assessment tools. And even within the textbook, they offer external references for you to go to find pain assessment tools, which can be customized for different populations. Once you know how bad the pain is, how intense, and what type of pain it is, that will drive the treatment that you ask for, and including type of medication and dosing. All of the medications used have different side effects, and you'll learn about those in your readings as well. It's best to prevent them, to forestall them happening in the first place, and that means knowing ahead of time what types of side effects might appear with your treatment plan so that you can make the patient and family aware to let you know right away if they show up. It's much better to treat them even at the beginning than to let them go on. There are many ways to manage them, and most of the side effects are GI related. If you're using NSAIDs like Advil or something stronger, a lot of that can cause GI bleeds. Opioids cause constipation and respiratory depression. They can also cause confusion and hallucinations in different individuals. So it's also best to get a full history of whether the patients have had these kinds of medications earlier in their lives to see if they might be anticipating any side effects. And as we mentioned in the previous slide, be sure when you're assessing pain and managing pain to also poke around and ask about mood, depression, and anxiety. Ask about sleep. Sleep is my research area, and it's often ignored especially in palliative care patients. You'll also learn that there are many factors that influence your ability to assess and manage pain. First and foremost, it is what the patient says it is, and it's also related to what their goals are. Do they want to be pain-free? Do they want to feel the pain so it makes them feel more alive? Some age groups, cultures, sexes have more or less of a tendency to discuss pain or overplay it or underplay it. So you have to really get to know your patients well to be able to properly assess and then manage the efficacy of your pain treatment. You have the ability to have a greater or lesser effect on pain depending on what type of pain it is. So again, it's very important to have a good rapport with your patient and their family members so that you can know exactly what's going on. Certain medications cover different kinds of pain. That's one type of coverage that we're talking about. There's also the cost of medications and whether the individual's particular insurances will cover particular medications. Your treatment plan may be driven by whether or not a particular medication is covered, and if not, then whether the patient and family are able and willing to pay for that. There are also other factors that influence your ability to manage pain, such as half-life of the medication and dosing. Dosing can be related to patients' abilities to swallow if it's oral, their ability to tolerate an IV, or whether they have IV access, such as a central line. So these would all be factors that influence your ability to manage pain. You may need to combine several things if there are medications with different half-lives that you can sort of leapfrog throughout the day. So in this course, you won't get into that level of detail, but as you start to work with palliative care patients in the future, you likely will encounter the need to think about those things. There are certainly ethical issues associated with pain management, especially in the palliative care and hospice patient population. The dosing in this population will be higher than you've probably encountered before, and maybe even than you can imagine. The ethical issues vary by setting as well. Are the patients in an acute care setting? Are they in a long-term care facility? Or are they at home? As you can imagine, having large quantities of opioids in the home may present certain ethical issues. And then there's the issue around patient-controlled analgesia. Who pushes the button? Is it the patient, or can a family member push it? Can the nurse push it? That kind of thing. Think about that as you're reading about pain management. There's also diversion issues of theft, again, primarily if it's a home care situation with having lots of opioids or even IV liquid medications in the home. You may need to take specific precautions there. You may feel like the amount of medication you're giving is excessive. So as you read through things, think in the back of your mind about what ethical issues you might be faced with in managing patients' pain. Depending on your particular specialty, you may prefer to emphasize non-pharmacological approaches, and certainly to blend them with the pharmacological approaches to pain management. You can help pain management by increasing patients' mobility through physical therapy and occupational therapy. Massage therapy is sometimes used in palliative care and hospice patients, and addressing spiritual pain as well can help control the physical pain. So think about, within your own specific specialty, whether you can augment the pain management with non-pharmacological methods. You can also indirectly influence the pain management by treating some of the other issues that we've discussed, such as mood disorders, depression, anxiety, and certainly by addressing sleep. As with every module, it's a good idea to start with the end in mind. As you're doing your readings, be sure to know which discussion board will be your initial post and which discussion board topic will be your response to peers. You're assigned to this based on how your last name is spelled, so be sure to check Blackboard. The general topics are ethics and side effects of pain management. For the QSGA, again, your focus of the QSGA depends on how your last name is spelled. See Blackboard for that. There are several topics for the QSGAs, basically from the readings. Be sure to see Blackboard for which topic is yours and which materials are fair game to be covered. Of course, as always, you will be responsible for all of the materials, even if you're not writing a QSGA for that, because, of course, the materials will be on the quiz. And speaking of quizzes, you'll note that quiz number 1 falls during the calendar dates of this module. See the course schedule for specific dates, and be sure to allow yourself enough time to study for the quiz and enough time set aside to take it. Again, as you're going through the learning materials in this module, think about your initial discussion board post and your QSGA. And here's how I suggest going through the materials. This is, as usual, just a suggestion. Feel free to approach whatever works for you. This is a long module, so again, be sure to pace yourself and allow enough time. There is absolutely no way to do this entire module in 1 or 2 sittings, so be sure to schedule yourself some time. I would look at the chapter titles and section headings first, just to get an overall idea of what topics will be covered. Then go through the table of contents of the World Health Organization document and read the sections on pain. This will give you a good idea of the kinds of things palliative and end-of-life and hospice patients experience. Then go through the geriatric pain assessment information. There's a video in there about pain and dementia. That is a good thing to watch to give you a good idea on how you might want to tailor your assessment depending on whether you have a special population or not. Then read the American Society of Pain Management Nurses, ASPMN, position statement on as-needed medications. This will help you think about ethical issues as well. When you start reading Chapter 6, I suggest reading the case study on page 131 first, then read the whole chapter. Similarly for Chapter 7, read the case study on pages 148 and 149, then read through the chapter, and then read through Chapter 12. And as usual, be sure to take notes and keep a diary as you're reading and watching. And please, please, please use Ask a Question and or email if you have questions as you're going through this. And of course, be sure to read and understand the assignment instructions, have the rubrics in front of you when working on them, and turn in all written work to both links.